And you're welcome to the Frontline segment, a segment that we've dedicated to celebrate all our people who are working on the front lines for us. So today on Frontline, I have some more reality stories of some of our frontline workers. We'll be talking to Dr. Hadi Mohammed Abdullah, who is a neurosurgeon at the Kolebu Teaching Hospital and also my guest for today. But before I bring him in, I want you to take a look once again at their appeals. Frontline workers' appeals for you to stay at home. We can now talk to Dr. Abdullah. Hello, Doc.
Hello, yeah. How are you?
Right. Thank you. I'm fine. And how are you doing?
Well, I'm doing fine. Physically, I'm doing very well. Maybe I would say emotionally a bit down, but
okay, yeah. And that's exactly where I'm coming to. Hopefully we'll be able to raise your spirit. So for those of you who are watching, if you saw that video that we just played to you, there's one man who's standing behind those who are speaking, who is wearing a white jacket. That's Dr. Abdullah. He's the one that we're talking to right now. And so, Doc, usually I love to start with how your life personally has changed since COVID-19. Do you want to share that with us?
Yeah, I would say that it has really changed quite significantly. Most of the things that we took for granted now means so much to us. And for some of us who are always facing the fire every day, and in our case, it's even more of an invisible enemy. I know that word has been used several times to describe COVID-19, but for those of us who are not at the treatment centers, but are faced with patients on a daily basis at the clinic and in theater, where we don't even know their status, that's where the danger is. And so I've basically developed some form of like an OCD, I should describe it, where I am washing my hands. I know sometimes beyond even what I prescribed that other people should do, using sanitizers as many times as possible. The sad thing is anytime I come home, I have my son who is very close to me. Unfortunately, I am unable to meet him at the door. It's painful. And sometimes it saddens me that we have to live our lives that way. He always wants to hug me. It's so difficult. And this afternoon, when I came home shortly to pick up something, I had water with me, and he wanted to drink my water. I said, no, you cannot have my water now. You should know about corona disease. And since then, he's refused to talk to me for the whole period that I was at home, because Daddy had water and didn't want to give it to him.
Oh, yeah, that's so sad. That's so sad. But yeah, are you able to find a way to explain this to him? How old is your son, by the way?
My son is 3 years, and my daughter is 8 years. She is well informed.
Okay.
But my son only knows that there's something called coronavirus and it's dangerous, but it's been quite difficult. But with my wife and my daughter and my sister-in-law, we are all trying to educate them. But I would say that the schools have really done well.
Okay.
Because my daughter is really well informed. At 8 years, she's really, really well informed about it, and she's taking all the precautions. The problem is the little one.
I'm sorry that your son thinks that you're being a wicked father because he had water and you won't give him. But let me bring you back to your emotions quickly before I take you back to the hospital, and we'll talk about that briefly. You said you were emotionally down. Does that have anything at all to do with the times we're in?
Yeah, I'm somebody who likes to exercise, play football, and I'm unable to do that. And sometimes when I'm driving home alone, the loneliness, how quiet the environment appears to be.
Yeah.
You know, you feel like there's a dark cloud around the world, and we are not able to live our normal lives. You know, but there are also times that I say, look, I can be exposed to anybody with this virus without knowing, because I'm still going to the emergency to see patients. I'm still seeing patients at the clinic. I have patients on my ward, you know. And there's a report this week which came out from Germany, which shows that quite a significant number of people who tested positive actually did not show any signs and symptoms. So we are beginning to see patients who are coming to see us with, say, different ailments, but could have been COVID positive, you know, and unnecessarily expose us. Unfortunately, the difference between us and those working at the treatment center is that they have all the cover. They have all the cover.
Because they know that it's sort of obvious the dangers they're exposed to, but not so obvious on your side.
Exactly, but you know, we are dealing, like I said, with an invisible enemy. And in some reports, really, about 50% of those who tested positive did not show any symptoms. And I'm sure the story is not that different in Ghana. And that is how dangerous it is. Because we are never prepared. And we can't be prepared. We can't have enough preparation.
Right.
You know, unfortunately, the sad thing is, the patients you saw and suspected had the virus, but didn't have enough cover. The moment the patient tests positive, everybody then changes into PPE, but you would have been already exposed.
Yeah. So
that is what those of us who are still active on the ground are going through.
Right.
That dilemma. You can't be sure what you are bringing home to your family.
Yeah, and I've spoken to a number of doctors, nurses who say the same thing that you have said to us today. And hopefully segments like this, as we have created here on this show on JoyNews, will, you know, light up your spirit a bit. I mean, I have children who are wishing people like you well and saying that don't stop what you're doing. We're here, we support you, we love you. And so we hope that those things will lift your spirit up. But let's look at the challenges that you've had to deal with. I think you've highlighted some of that in what you said already. But when it comes to the provision of PPEs for people who are in the hospital, who are not necessarily working directly with those who have coronavirus, what is your report from where you sit?
From where I sit, I think that those people have been neglected. They have been really neglected. You know, I on my own decided that I was going to buy my own face masks and PPE. So I bought my own N95, which I encourage my junior colleagues to do the same, because nobody really identified us as a risk group. So we were not provided with the PPEs. So you had to buy it on your own. But we've had nurses and doctors testing positive in the very hospital that I work in.
Yeah.
You understand?
Yeah.
And there are some of us who have had our samples taken because we've come into tested positive patient we have been managing has been. These are the real issues.
So have you had your samples taken?
Yes, I've had my samples taken. All my colleagues have had their samples taken. You know, and the danger is that some of us work in a highly specialized areas, that when we have just a single exposure, the whole unit may have to be closed down. I'm a neurosurgeon. Today I've had calls from several colleagues around the country who want to send patients who have bled into their brain, who need emergency surgery. If neurosurgeons are overexposed to the extent that we have to self-quarantine or have to be isolated, what it means is that neurosurgical services in the country will be extremely, extremely hampered. And many people will die unnecessarily, not but from very serious emergencies that they needed surgery. And this is what is worrying.
Right. Hopefully we won't get there.
Some of the calls I received today, some of the calls that I received today, there are conditions that They need simple neurological intervention to survive, but it is time-bound. If you don't do it early, you lose the patient from something that a preventable death.
Right.
You know, so my call is that, look, the PPE should be made available to every worker, every healthcare worker who is working at the clinics and the emergencies, because that is where the danger is. That is where the danger is. I tell you what, this same patient that some of us were exposed to, we saw the patient without the necessary PPE, okay? But the moment we called the public health team, they came in full PPE. And this is a patient we've been exposed to as close as
previously.
3 weeks. Yeah. You understand?
I do understand that, but so this is not... Go ahead, Doc.
Yeah, I know, I don't want to belabor the point. I've heard people talk about it, but we just have to pray that none of us came positive.
I'm hopeful that your results will come.
To do.
I'm hopeful that your results will come negative.
If we don't take the issue of the PPE very seriously for workers like us, we're going to have lots of healthcare workers getting exposed. They will be going home with the viruses and will be silently infecting the communities without knowing. There are healthcare workers who are being picked from our various hospitals in public transport every day. Every day we have nurses, doctors sitting in the Ayalolo bus. We don't know which nurse is affected. But for the fact that they work in hospital and are not at the treatment centers, they are not getting enough protection. And that is where the danger is, because if any of them get infected, they are still going to the communities. That is the danger.
Right. So I'll take your very final words. But before that, I just want to remind people. I mean, this video has been going around. I just want to remind people of who you are, and then I'll take your final words. So take a look at Dr. Abdullah's humble appeal for you to stay home so we can contain this virus. Let's wrap this conversation. Like I said, every now and then we'll be able to come back to you and find out how you're doing, how your other colleagues are doing, and certainly we'll keep an open eye and ear for that report, which I believe will be negative. But Doc, let's take your very final words as we go off from here.
Yeah. Can I speak in Hausa again, or maybe I can speak in English?
You can speak in Hausa, and just for me, you can translate it for me, if you can make it brief.
Okay. Yawa ina na roko kamar yadda ka san ciwon coronavirus ko COVID-19 yanzu ciwo nan na gari ya alitudu ma duka an samu mutane da ke da wannan ciwo. Yankuri ina roƙon ku a bari zuwa masalaki ana sallan jama'a, a bari wannan in ka je wani buta kuma na nan da ka yi alwala da shi, ka yi kokari so ka wanke hannunka da ruwa sannan ka taba wannan buta. Sannan ina roƙa yawanmu da ke Nima da Mamobi da Ashama da Nungwazungu da zonganinmu duka ina roƙon ku, ciwon ga gaskiya ciwon nan ina nan cikin garin nan, and yara na mutuwa da ciwon ga manya na mutuwa da ciwon, kowa ya yi mutu. And what I said is I'm appealing to my people from the various zongos, including like my Muslim brothers and sisters, and that they should desist from congregational prayer, which has been banned. And the fact that I am aware that people are still even praying in congregation at home, which is not good. And there's a typical kettle that we use for ablution called buta, which several people can use at a time. I'm appealing, if you have one at home, just know that this virus is real. And as much as possible, we should wash our hands with soap before touching the kettle to start our prayers. Our ablution. And when you finish, you should do same. And if possible, we should avoid using it at all, and can use tap water, or you can buy sachet water and let somebody pour it for you whilst you perform the ablution.
I think actually you can hold it yourself whilst you perform the ablution. I've lived in
the problem is that everybody uses it, so if you hold it, you can easily infect it.
No,
so
I mean holding the water yourself, holding the water, the sachet water.
Yes.
The sachet water that you can hold it yourself. Yeah,
exactly,
I've lived in the Zongo before, so I understand how it works. But look, I'm hopeful that we've been able to uplift your spirit a bit in these very hard times.
Thank you.
We hope that you can.
You made me laugh very loud.
That's good. So I hope that you can spread this positive energy across to your other colleagues. Some of those who have come into direct contact with this COVID-19 case that we're talking about, and keep your spirits up. We are hopeful that the results will come negative, and even if it is positive, it is still not the end of the road. Thank you so much.
Yeah.
We've been talking to Dr. Hadi Muhammad Abdullah. He is a neurosurgeon at the Kolebu Teaching Hospital, who has been my guest for today. Very insightful things he has said to us. He has a special appeal to the Zongo communities. He's saying that if you have a buta at home, you can use that and not share with others, and that try as much as possible not to congregate, because he's hearing that people are still congregating in the various places of worship. I hope that has gone down well as we all stay at home. So as I wrap up on Frontline, let's focus on the University of Ghana Medical Center, which is one of the designated facilities for treatment of COVID-19 patients. And I start with this young health professional who misses hugging his children and had to be frank with his family about the uncertainties of his return time home. For him, it's a time when you can't get too close to other people, especially as a health worker, even if it's your family or people you love the most.
Oh, it's kind of a little stressful, though. I mean, you get home, you have to remove your clothes literally outside and do your hand washing, wash your hands before you can get into the house. They can't hug you as usual when you get home. So it's a little different. Of course, everybody else is kind of staying at home, but you still have to get up every morning and get to work and get back. Like today, for example, they asked like, hey, will you come home early enough? I said, well, I can't tell. So, you know, it's quite different.
Have you got to a situation whereby you get home and your wife or your kids don't want to come close to you because daddy is taking care of a coronavirus patient?
Oh, well, it happened like 2 days ago. I wouldn't say my daughter was coming to hug me. I was not too sure myself whether she should hug me or she shouldn't, you know, because of all this. So he said, hey, why dad, did you have COVID-19 or something? But, I mean, it's a little funny, though. I mean, the interactions will change. You don't want to, as it were, get too close to them and all that. I don't know. I mean, it's quite different.
As a family man, living a life before this COVID-19, how do you feel looking at the past where you can get home and then hug your children and now you can't do that? Is it taking some kind of affection away from family?
Oh, I mean, a little bit, but at least you go home so you see them, but you don't see them more or less and have, like as at first, once you get to the home, everybody will come around the car, you know, you do some greeting, some hugging, but now it's not like that. So a little bit of that is taken away, but hey, that's the job. So yeah, we are also working and enjoying the job as well.
As a doctor, how is the fear like when you come to the facility and you know very well that this is a corona patient person and you need to take care of that person? Does it come with some level of fear?
Oh, it comes with some kind of trepidation, but the point is that we've also been trained. You put up your PPEs and then you go in and you treat the patient. So it comes definitely with some fear, having heard that some health workers have been infected whilst doing the work. So definitely there is some fear, there is some stress relating to that, but we also take the precautions and hope and pray that everything goes well.
That's been your Frontline for today. And for all of those of you who are working out there, security operatives, well, those of you even in the media, my colleagues, all of us, we say we celebrate you and we congratulate you for the work you're doing, putting your lives on the line for this and for all of us.